Hello guys, welcome back to my YouTube channel, Dr. Shahnawaz. And in this lecture, I will talk about the upper gastrointestinal bleeding. The GI bleeding that arises from the upper GI tract is the GI bleeding, as we know that upper GI bleeding. And at the end, you will know that what is upper GI bleeding and what are the specific causes of upper GI bleeding and what are the signs and symptoms of upper GI bleeding, and what could be the methods due to which we can diagnose the upper GI bleeding. And continuing, uh, we should know that what is upper GI bleeding. Upper GI bleeding that arises from the upper GI tract, like above the ligament of Vertices, the organs which are GI organs which are present up to the ligament of the Vertices, that is also called the suspensory ligament, is called the upper GI bleeding, in which esophagus, the stomach, and the duodenum is containing. And commonly, the bleeding arises from the esophagus, the stomach, or the duodenum. And the symptoms may depend on the amount of the blood loss, like how much blood is lost from the GI bleeding, in which the shock is included, like the syncope, the fatigue, or other things in the GI bleeding. And we observe that there is blood in the movement or the black stool that is containing the altered color, like we see that in the Malena, the black stools are like that. And what could be the causes of the upper GI bleeding? We have different causes of upper GI bleeding. The patients, like who are taking the medications, including NSAIDs or the antipsychotics or the antidepressants, that may lead to the injury to the mucosa of the GI tract. And sometimes we see that there is hemorrhage to the mucosal surface of the upper GI tract, and the submucosal veins are dilated in the mucosal vertices, and we see that the mucosal surfaces are inflamed due to some infection or due to using of NSAIDs as discussed above, and at the end the ulcers, like there is damage to the inner lining of the esophagus or the stomach or the duodenum. What could be the esophageal sources of the upper GI bleeding? We will see that there is varices in the esophagus. See in this picture that we have the dilated veins on the submucosa, and that results from the GI bleeding. Actually, the GI bleeding is the complication of the esophageal varices, and as well we see the inflammation of the esophagus, and that is the esophagitis, and the GI bleeding may be may be present as complication of the esophagitis, and the tumors like adenocarcinoma, so the squamous cell carcinomas in the esophagus may result in the upper GI bleeding. And look at this. This is the junction of the esophagus and the stomach. You see that there is lacerations of the mucosa that's called the Malena syndrome, and it results into the upper GI bleeding. And this is important. And more than this, we see that there is Borhave syndrome, like there is increased esophagus pressure, decreased intrathoracic pressure, due to which esophagus have perforation, and this is the most important medical emergency. In this slide, you studied and you saw that there is esophageal sources of upper GI bleeding, and in this slide you see that what could be the gastric sources of the upper GI bleeding. Like we see that the upper GI bleeding could be present as a complication of the gastric ulcer, in which you look at this picture, you see that the inner lining of the esophagus may be damaged, due to which they may lead to the GI bleeding. And the gastric cancers may be present as tumors that can bleed as there is rupture or perforation to the mucosa, or the gastritis, the inflamed gastric mucosa may lead to the bleeding as well. The gastric varices, the inflamed submucosal veins, could be the cause of the bleeding in the stomach, and the duodenal lesions that you see that there is white arrow. You see the arterial rupture in this picture is present, in which the stomach lining is damaged, and that may lead to the lesions, and that could be the source of the bleeding. And continuing to the lecture, we see that what could be the duodenal sources of the GI bleeding. You see that duodenal ulcers, which may be present because of many causes, alcohol, the NSAIDs, the other like stress would cause the duodenal ulcer, and the bleeding could be present as a complication of the duodenal ulcer. And aortic fistula, look at this scan, you see that the white arrow presents that there's fistula between the aorta and the intestine. That could be the source of bleeding in the intestine, and that may present at the upper GI bleeding. This is the secondary to the aortic aneurysm, and don't just margin it to the aortic aneurysm or other diseases of the aortic. This is the specific cause of the that is secondary to the aortic aneurysm treatment. The hematochezia, the bleeding could be present from the biliary tract bleeding, or you see the hematemesis pancreatitis, due to which the pancreatic duct may be the source of the GI bleeding in the duodenum. And look that the superior mesenteric artery syndrome, in which the duodenum is like compressed between the aorta or abdominal, between the abdominal aorta and the superior mesenteric artery, that will lead to the mucosal injury, and that is the source of the bleeding. And look that what could be the signs and symptoms of upper GI bleeding. The most important sign of the upper GI bleeding is the hematemesis, that is the wounding of fresh blood. Look at the picture, this is the fresh blood, and we may suspect that there could be the bleeding into the esophagus, the stomach, or the duodenum. And this is always an important sign of the upper GI bleeding. But sometimes the hematochezia or epistoxis may be confused with the hematemesis, and we see that there is no GI bleeding, but we see that there is damage to the nasal bones, and that could be the epistoxis may be present, but we should be careful that we don't confuse the hematochezia or epistoxis with the hematemesis. And look at this picture, you see the coffee ground wounding, and this is because in the stomach there is oxidation of the bleeding, and the blood may be turned back into coffee ground like wounding. And the Malena, the dark black vertices, may be present because of the, like when the blood is in the duodenum, when it passes all through the lower GI tract, it could turn into the dark black feces. We see that further, if there is severe hemorrhage to the mucosal surface, we see the hematochezia, that is the maroon color stool, may be present, and the presentations of the GI bleeding, like how the patient present, it mostly depends on the bleeding amount, like how much blood is lost, and the location of hemorrhage, like if there is hemorrhage present just close to the vein or just close to the artery, that could be the main like criteria that we should know about the presentations. And other complications of the GI bleeding could present anemia, that the blood is lost, and the chest pain because there is like a just burning in the ulcers or like that, and the syncope and the fatigue. At the end, we see that the patient may present as the shortness of breath. And look at this picture, like how can we diagnose how can we find the source of bleeding, like where is the bleeding occurring, where are the varices, or there is hemorrhage, or there is some ulcer. To confirm that source of bleeding, we do the endoscopy, like we put an endoscope into the upper GI tract, and we take the biopsy to confirm that if there is some tumors, the inflammations, or other things like that. Well, I have finished the lecture on the upper GI bleeding, and in the next video I will be talking about how to manage the upper GI bleeding. Till now, thank you for your attention and hope to see you in my next videos.